Hello and welcome. Thank you for joining us tonight. We are excited to introduce you to Uplizna, a treatment for adult patients with NMOSD who are anti-aquaporin 4 antibody positive. We wanted to thank sRNA for partnering with Velo Bio to share information about this new treatment for NMOSD. Please note, tonight's webinar will be recorded. To start, I would like to welcome Gigi DeFibri. Gigi, please unmute your microphone and turn on your video now.
Hi, everyone. Oh, here we go. Let me start sharing. There we go. Hi, everyone. Hopefully everyone can see and hear me. My name is Gigi DeFibri, and I am the Associate Director of Research and Education at sRNA. sRNA is a nonprofit that's focused on support, education, and research of rare neuroimmune disorders, including NMOSD, and you can learn more about us on our website, which is wearesrna.org. Also, for some of you who are able to attend, we are having a one-day virtual symposium this Saturday, where we will have a talk on all of the treatment options available for NMOSD, as well as a session with representatives from Velo Bio. We're very excited about Velo Bio's new treatment for those with NMOSD and are very grateful to be able to provide this educational opportunity for our members with them. If you have any questions about sRNA, please reach out to us via our website or via email. So thank you. We're really excited about this.
Thank you, Gigi. Now, I would like to introduce Cheryl Lapidus, Head of Patient at Velo Bio. Cheryl, please unmute your microphone and share your video now.
Hi, everyone. I'm going to, there we go. Hello. Gigi, thank you so much. And we at Velo Bio would like to extend our sincere thank yous to everyone at sRNA for your partnership and co-hosting this opportunity to share information about Uplizna. I am the head of patient engagement at Velo Bio. And I have the honor of being able to work with sRNA and the other NMOSD patient advocacy organizations to support patient community. You'll be hearing from several people this evening. First off, you'll hear from Dr. Marie Mealy, who is with the Medical Affairs Department at Velo Bio. She'll be giving you an overview of NMOSD. And following Dr. Mealy, you'll hear from Dr. Jeffrey Bennett from the University of Colorado Unschultz Medical Campus, Department of Neurology and Ophthalmology. Dr. Bennett will be reviewing Uplizna, the Momentum trial, and important safety information about Uplizna. Following Dr. Bennett, you'll hear from Sally. Sally is an individual living with NMO, and she's going to share her personal story as she's been prescribed Uplizna. She'll tell a little bit about her own experience. And then finally, but certainly not last and least, is Denise Butler. Denise is Director of Patient Support Services at Velo Bio, and she'll be sharing about information about those patient support services. Next slide, please. So a little bit about Velo Bio. Our mission at Velo Bio is to improve the lives of those impacted by serious, underserved, inflammatory, and autoimmune diseases. We lead with scientific innovation and are firm believers in cultivating an environment that fosters creativity and collaboration. Next slide, please. Our philosophy is multifold: to improve access to innovative medicines and focus on underserved patient populations while promoting a culture of science and giving back to our community. We at Velo Bio always remember to keep the patient at the center of everything that we do. So thank you again for joining us, and we look forward to hopefully getting to know you a little bit better in the future. Thank you.
Thank you so much, Cheryl. You will now hear from Dr. Maureen Mealy, Medical Affairs at Velo Bio. Dr. Mealy, please unmute your microphone and turn on your video now.
Thank you. I'm so thrilled to be here and speaking with you all today. I'm just going to take really a few minutes to talk about NMOSD. Next slide, please. So some of you are the people living with NMOSD, and so you know that this is an autoimmune disease of the central nervous system that preferentially targets the optic nerves in the spinal cord and really can lead to problems with vision, problems with mobility, pain, as well as bowel and bladder dysfunction. And that's just some of the main things that this can cause, but as you all know, this disease really encompasses a lot of aspects of daily life. Now, it's a relapsing disease, and disability accrues with each relapse. And so we do know from descriptive studies that it really can impact your lives. And so reducing the risk of relapse is an important component to managing this disease. Next slide, please. Now, the prevalence of NMO and its demographics are really evolving as we know more about this disease. Certainly, the discovery of the very specific aquaporin 4 IgG helped us to learn more about these about the prevalence of this disease, but it is still continuing to evolve as practitioners are recognizing it more and as the diagnostic criteria evolve over time. But we do know that this disease disproportionately affects women of color. About 9 women are affected for every 1 man who's affected, and the prevalence has been found to be higher in those of African and Asian descent. And it's women who are really in the primes of their lives. The median age of onset is 40 years old, although it's quite a broad range of patients that can be affected by this disease. As I mentioned, there's a highly specific antibody that was discovered in 2004, the aquaporin 4 antibody. And the patients, about 80% of patients have this antibody who have this disease in the most sensitive of assays that are available. And this antibody is a pathogenic antibody, and we don't really know why these patients develop antibodies to an otherwise benign protein that exists in all of us. Next slide, please.
Thank you, Dr. Mealy. Please join me in welcoming Dr. Jeffrey Bennett. Dr. Bennett, you may now unmute your microphone and turn on your video.
Good afternoon or good evening, everyone. I'm Jeffrey Bennett from the University of Colorado Anschutz Medical Center. And in the next few slides, I'm going to review some of the clinical trial results, mechanism of action, prescription information, and safety information for Uplizna. Uplizna, next slide please, is an FDA-approved treatment for aquaporin 4 autoantibody seropositive neuromyelitis optica spectrum disorder, or what I'm going to abbreviate as NMOSD. As noted in the Kaplan-Meier plot of relapse risk on the left of this slide, Uplizna reduced the risk of NMOSD attack by 78%. At almost about 90% of NMOSD patients treated with Uplizna were relapse-free at 28 weeks versus 58% of patients treated with placebo. Hospitalizations related to NMOSD attacks were reduced almost 5-fold from 50% in placebo-treated patients to 11% in Uplizna-treated patients. Next slide, please. Uplizna works by depleting B lymphocytes, or B cells, thereby modulating the immune response. The exact mechanism by which B-cell depletion exerts its beneficial effects in the treatment of NMOSD is unknown, but may involve one or more of several mechanisms, including decreased production of aquaporin 4 autoantibodies, inflammatory messenger secretion that is decreased from B cells to other immune cells, or in general the reduction of immune cell activation. Despite its beneficial effect on the autoimmune response in NMOSD, Uplizna treatment did not increase the risk for infection. Side effects or even serious adverse events were not more frequent in Uplizna-treated patients versus those treated with placebo. The most common reported adverse events, as shown on the slide, include urinary tract infection, joint pain, headache, and back pain. Infusion-related reactions were infrequent in treated patients and occurred in less than 10% of treated individuals. Next slide. The Uplizna and Momentum trial was the largest randomized double-blind placebo-controlled clinical study in NMOSD and enrolled 230 NMOSD patients in over 25 countries. Uplizna was studied in both aquaporin 4 seropositive and seronegative patients as monotherapy. That is, no other immune suppressive therapy was allowed during this treatment trial. The amount of seronegative patients that were enrolled were rather minimal, and therefore the results and the approval are concentrated on the aquaporin 4 IgG seropositive patients. Next slide. Uplizna is a therapeutic monoclonal antibody that is infused intravenously over the course of 90 minutes. The initial treatment is comprised of 2 doses of 300 milligrams administered 2 weeks apart. Subsequent doses of medication are administered once every 6 months thereafter. Next slide. Whether you were recently diagnosed with NMOSD, have established disease and suffered a recent attack, or even on relapse-free on one of several unapproved therapies, it is prudent to have a conversation with your doctor about whether Uplizna can benefit the care of your NMOSD. Your physician will be able to review other important issues about Uplizna treatment and overall care of your NMOSD, and it's always important to remember not only to talk with your physician about your general care, but any other subtle symptoms such as those on the right that might relate to undercover disease activity. Next slide. To review, Uplizna is a novel monoclonal antibody treatment approved for the treatment of NMOSD that is aquaporin 4 seropositive. Patients with active hepatitis B and active or untreated tuberculosis should not receive Uplizna. Your doctor will test you for hepatitis B and TB prior to initiating treatment. Before treatment, patients should receive any required vaccinations and, if pregnancy is possible, use some form of active birth control. It is currently unknown whether Uplizna can harm a developing baby. Uplizna may pass into breast milk, and therefore any infusions scheduled in breastfeeding mothers should be monitored and rescheduled appropriately. Next slide. During Uplizna treatment, patients should engage with their prescribing physician and inform them of any adverse events or changes in medication while on therapy. Yearly, patients will be tested to ensure that they have not been infected with hepatitis B or experienced hepatitis B viral activation. Next slide. Rare infections such as progressive multifocal leukoencephalopathy, a reactivation of latent viral infection with JC virus, may occur with Uplizna. While PML has not been reported to date in Uplizna-treated patients, PML has been infrequently reported in patients treated with other B-cell depleting therapies. Symptoms include weakness, confusion, loss of coordination, or changes in personality, and could be confused with an NMOSD attack. As a reminder, Uplizna is delivered intravenously in concert with additional medications to minimize infusion-related reactions. The first dose is given as 2 infusions 2 weeks apart, and then subsequent infusions are delivered once every 6 months. Next slide. Possible side effects include infusion-related reactions, urinary tract infection, headache, and joint pain. Blood counts will be routinely monitored in treated patients to assess therapeutic efficacy and to test for safety. Thank you very much for your attention.
Thank you, Dr. Bennett. As a note, the full safety information and prescribing information for Uplizna is available for download in the File section on the bottom right of your screen. To download, please click on the document name. Next, please join me in welcoming Sally.
Thank you for having me here today to share my story with you. In 2016, I started to get a strange pain in my right arm and hand, and it felt like a combination of numbness and shooting pain. At first, I thought I had a pinched nerve, so I went to my primary care physician and to try and figure out what was wrong. Following an MRI, ER doctors determined that I had suffered from a stroke. And that didn't make sense to me at the time because I was a healthy, active person, regularly hiking and doing regular physical activity. So I was surprised at that. After the stroke diagnosis, I met with a neurologist and requested a full MRI to also include my cervical spine since the pain was in my arm. The MRI showed lesions on my cervical spine, and I was diagnosed with MS. As the numbness continued to worsen, the neurologist referred me to an NMO Center of Excellence to determine the specific type of MS and treatment options. The neurologist confirmed that the lesions were still leaky and the disease was active. I was treated with oral prednisone until I could be put on IV steroids. But while I was waiting for the approval to come through for the IV medication, the vomiting began, and I was nonstop vomiting for 24 hours and not sure why. I later learned that this is one of the symptoms of NMOSD. I was treated with IV steroids, which slowed down the numbness, but the pain continued. My neurologist decided to do a spinal tap and a blood test, which showed the presence of aquaporin-4 antibodies. I was then finally diagnosed with NMOSD. I learned that NMOSD can manifest itself in many different ways, and because of this, it's often hard to diagnose. The numbness and shooting pain I was dealing with was due to the inflammation of my spinal cord. My neurologist explained to me that NMOSD can also cause inflammation of the optic nerve, causing vision, pain, and problems. Luckily, I never experienced any of those symptoms in my eyes. It took about 3 months from my initial symptoms to my diagnosis of NMOSD. I know firsthand that because of the variety of symptoms, the disease can be difficult to diagnose, and there's often many initial misdiagnoses. Once I received the NMOSD diagnosis, my neurologist told me about the treatment options available for patients living with NMO, and there were none, so no approved drugs at the time. So I was enrolled in a clinical study now known as Uplizna. My physician explained that Uplizna is designed for patients with NMOSD and is designed to deplete the B cells that are making the antibodies which lead to the disease. After learning more about the drug, it felt like the right drug for me and that it would fit into my lifestyle. When I first started treatment, I was meeting with doctors about once a month for routine tests to see how I was responding. After using Uplizna for several years, I now get an infusion every 6 months. It fits well into my routine. Before beginning the Uplizna injection, I first receive a steroid, an antihistamine, and a fever preventer to help avoid infusion reactions. The whole process takes about 4 hours and is followed by an hour of observation. My care team also gives me an examination to check in and ensure that I'm healthy before the infusion. Although everyone responds to treatment differently, after treatment, I have a full appetite, normal energy level, and I'm able to drive myself home. To date, I haven't experienced any side effects from the treatment. This is my experience only, and patients should always discuss what is right with their doctor, the right treatment option. Since using Uplizna, I haven't had any additional attacks. While I take certain precautions, knowing I have a suppressed immune system, I've been able to continue to do things I enjoy. I can still teach 2nd grade. I can travel, spend time with my family, and be active outside. Personally, I feel less anxious about traveling and being away from home and doing things I love because I no longer have been having attacks since using Uplizna. Because I have nerve damage in my hands, I still have some numbness and pain. But overall, my symptoms are under control, and the fear of NMOSD attack no longer guides my decision making. Thanks for listening to my story.
Thank you so much for sharing your story with us, Sally. Finally, I would like to introduce Denise Butler, Director of Patient Support at Vela Bio. Denise, don't forget to unmute your microphone and share your video now.
Good afternoon, everyone. Thank you so much for joining this evening or afternoon. Again, my name is Denise Butler, Patient Support Services Director here at Vela Bio. We certainly appreciate your time and engagement this evening. I wanted to take just a few moments to give you some information about the Vela VIPs program. So when you think of Vela VIPs definitely sticks out. Most people think of very important player, very important person. Well, here at Vela Bio, we consider VIPs a very important person and patient. So what we have tried to do and endeavored to do with our patient support program is create a program that is comprehensive, that will encompass all patients that have been prescribed Uplizna, their caregivers, as well as their healthcare professionals, because we understand that this journey to treatment and living with NMOSD, it does take an entire comprehensive effort from everyone involved to make sure that patients stay on journeys and stay on treatment. Personal care managers are available with the Vela VIPs program. They are able to provide benefit investigations, assess for copay assistance, help patients, again, from the entire journey from start to finish. We realize that diagnosis journeys are very, very different. As Sally previously mentioned, her journey was very brief to the appropriate diagnosis, but we understand that that's not necessarily the case for each patient. So when a patient is prescribed Uplizna and that enrollment comes into the Vela VIPs program, the case manager will take an individualized approach to see where this patient is in their journey and make a treatment plan and a cadence for follow-up that is applicable and is perfect for that particular patient. Our case managers are also able to provide educational resources that will, again, help to educate, provide you all with options and resources that may be available, whether that be from an emotional support standpoint or as well as a financial support. With the Vela VIPs program, again, the initial step in enrolling is making sure that a conversation is had between the patient and the prescriber to make sure that Uplizna is the right fit for the patient. The physician would then complete the patient referral form and send that into the Vela VIPs program, and that will start each patient on their journey. We do have multiple ways in which to get additional information. If you're asking how you enroll, the great question would be to first start talking with your physician about getting that patient referral form completed. The referral form is an editable PDF version that can be found on our Vela VIPs website. It is www.velavips.com. If the physician or the patient has additional questions about the program, what service offerings we have regarding copay or free product assistance for patients that are uninsured, they can contact the Vela VIPs directly at 833-842-8477, and that is 833-VIB-VIPs. Again, we are very excited about the launch of Uplizna and the launch of the Vela VIPs program. If any questions are needed, the number and the website are listed at the very bottom of the slide listed below. Thank you so very much for your time and attention, and have a great evening.
That concludes today's webinar. On behalf of Baylor Bio, we would like to thank you for your time today. A special thank you to SRNA for allowing us to share information about Uplizna with your members. If you have any questions about the information from today's webinar, please email velaquestions@spectrumscience.com or contact your physician. Baylor Bio is not able to answer specific questions about your own condition, but we encourage you to reach out to your physician to learn more. Thank you and have a wonderful evening.